Hello everyone and welcome. In this video, we will be discussing regarding blepharitis. Now, by definition, blepharitis is a chronic inflammatory condition of eyelid margins and it is usually associated with some ocular surface disease or dysfunction of the meibomian glands or bacterial colonization. Blepharitis constitutes a common cause for dry eye syndrome and chronic eye irritation. It is classified into anterior blepharitis, posterior blepharitis, and mixed. Mixed is combination of both anterior and posterior. Now, anterior blepharitis, it affects the base of your eyelashes and the eyelid margins. Causes for anterior blepharitis include bacterial infection, most commonly by Staph aureus or Streptococcus epidermidis. It can be due to seborrheic dermatitis, which is associated with dandruff, or Demodex mite infestation. Then posterior blepharitis occurs because of dysfunction of the meibomian gland, which leads to abnormal oil secretion. Its causes include dysfunction of the meibomian gland, which can occur either due to thickened secretion or due to blockage of the gland. Another cause for posterior blepharitis is when it is associated with rosacea. Now, pathogenesis includes abnormal lipid secretion, which will lead to instability of the tear film. There is bacterial overgrowth. They produce exotoxins, which leads to chronic inflammation, and then chronic irritation, which leads to eyelid thickening, telangiectasia, and corneal involvement. Clinical features for blepharitis. In symptoms, patient will present to you with irritation in the eye. There is burning, itching, a grittiness or foreign body sensation might be there. Crusting of the eyelashes is there, especially seen in the morning. Redness and swelling of the eyelid margins, dry eye, and if cornea is getting involved, then there might be symptom of photophobia and blurring of the vision. In signs, what you will see is eyelid margin is erythematous and thickened. Collarets are seen. Collarets are basically scales and crust which you see at the base of eyelashes. Meibomian gland dysfunction, if there, then you will see frothy or thickened secretions. Abnormalities of the lash may be seen, which includes madarosis, which is loss of lashes, or poliosis, which is whitening of the lashes. In chronic cases, there might be conjunctivitis, keratitis, corneal ulcers, and chalazion formation. Now, diagnosis can be done by slit lamp examination, in which you assess the margins of the eyelid and the opening of meibomian gland. If you suspect corneal involvement, then fluorescence staining can be done to detect superficial punctate keratitis or ulcers. Meibomian gland expression can be done to assess the gland functioning. If you are suspecting Demodex mite infestation, then eyelash scrapings can be sent and bacterial culture can be done in severe or treatment-resistant cases. Now, management includes eyelid hygiene, medications, which is topical and systemic. There is advanced treatment modalities available and lubricants. So, lubricants is basically artificial tear for associated dry eye symptoms. Eyelid hygiene is the cornerstone of treatment in blepharitis. In this, you suggest the patient for warm compresses 2 to 4 times a day to be done for 5 to 10 minutes each. This is to liquefy the thickened secretions. Now, lid scrubs can be advised. There are commercial lid wipes available nowadays, or a diluted baby shampoo can be used for the same. Lid massage should be done to express the meibomian gland. It is mainly beneficial when there is posterior blepharitis. Medications, topical medications that you use is antibiotics like erythro or azithromycin if there is bacterial blepharitis. A short course of corticosteroids can be done in severe inflammatory cases. Drugs like loteprednol and fluoromethalone is used. If you suspect Demodex infestation, then tea tree oil in 50% concentration can be used. Systemic antibiotic therapy is used when there is severe or chronic cases, especially those with posterior blepharitis, meibomian gland dysfunctions. Oral tetracyclines like doxycycline or minocycline or azithromycin can be used. If it is associated with allergic blepharitis, then oral antihistamines can also be used. The advanced treatment modalities available nowadays is one is there is intense pulsed light therapy, which is done for meibomian gland dysfunction, and there is LipiFlow thermal pulsations. These are done to unclog the meibomian gland again. Complications associated with blepharitis: chronic conjunctivitis, one. Another one is involvement of the cornea, in which case it can lead to punctate keratitis or corneal ulcerations. And there is another term which is flectanular keratitis. There might be problem with the lashes, which is Trichiasis, that is, lashes are misdirected. Usually there is inward growth of the eyelashes. And madarosis, which is loss of the eyelashes. Recurrent chalazion or hordeolum formation can also be seen. Prevention for blepharitis: good lid hygiene should be maintained to prevent recurrences. Patients should be advised to avoid rubbing the eyes repeatedly, not to use any expired cosmetics. This was for blepharitis. In brief, thank you so much, and I will see you in the next video.